Hi, I'm Rahul and welcome to Fwrapper Aqua. In this video, like the cover page says, we're talking about metro treatment for your Flowerhorn fish. I've made a lot of videos about Discus fishes, treatments and all of that. So this particular fish is one of our followers called Pranesh from Belgaum, Karnataka. So he had contacted me and through email, and then we interacted, and then he sent me the fish's videos, how it was. It was a very bad condition. It was pooping white. And it was in a very stressed situation, not eating, and it was in a very bad condition. So we suggested the metro treatment, which we'll be talking about in detail next. So we suggested the metro treatment. He did it for about 5 or 8 days, and then after that, what you're seeing on screen is the fish which is completely recovered and doing well now, taking food, and even the head is popped back, and it's doing really well. So in this video, we're talking about the details about the metro treatment, how it has to be done, the dosage, and that's what we have covered in this video. See you on the other side. Before we get into what is metro, we need to find out why do we use metro. Metro basically is used in our fish hobby for treating a parasite called hexametha. Hexametha is basically a parasite which forms inside the fish's body, and it gets into its intestine, stomach, and because of which the fish kind of stops eating, it loses its appetite and it stops eating. Over time, what happens, the fish becomes thin and it narrows down in size and changes color, it becomes dark in color, and it starts pooping in white. All of these are symptoms. It will start moving away from all the other fishes and start hiding and all of that, because it's kind of losing its its charm. So that is a main reason why we use metro in our hobby. Why does this hexametha come into our tank? Main reasons can be bad filtration, bad water quality, excess stress for a fish where it's losing its appetite and it kind of not eating and not being healthy. You bought a new fish and you bought it to the house and directly add it into your fish tank without quarantining can also be one of the major reasons for your internal infection. And of course, one more thing, when a fish gets older, it gets the age, because of age factor, it loses its appetite and all that, and then because of that also this hexametha can form inside the fish's body. First things first, when you see this white poop or this dark formation or the fish is not eating, most important thing is that you need to shift the fish out into a hospital tank. The most important thing is that you need to separate the fish, because in a group of fishes you cannot actually observe one fish. So when you separate this one fish into a separate tank, then keep it there for some time, keep a heater, keep a basic aeration, and observe the fish for 1 or 2 days, see how it is behaving, and then you can start the treatment. So that is why it is very important to have a hospital tank. Why do we need a hospital tank? Because like I said earlier, Metronidazole is an antibiotic. Because it's an antibiotic, what happens? It kills all your bacteria in your tank, which is also good bacteria and also bad bacteria, which is really bad, because then you have to start your entire filtration process, your nitrogen cycle, all of that. So always better to have a hospital tank. A lot of people make this mistake of treating all their fishes because one fish is not well, which is not a good thing to do. It's like, I have a headache, then why my entire family should have a paracetamol? So that's the reason. So I think you should have a hospital tank, especially when you're keeping big fishes. One more main reason why we need to have a hospital tank is, if you see white poop, immediately don't start treatment. Shift this fish into the hospital tank so you can at least observe it for a couple of days, where you can see if the fish is actually pooping white, or if there is any waste, and if it's eating food, and then if it is recovering, you don't need to do any treatment. And sometimes fishes can also white poop when they actually are in excess of stress. That can be because of some fights, can be because of pairing, can be because they are newly added into a fish tank. All of that also can cause stress in a fish, and that also can be a reason for pooping white. So all these reasons are there. So don't immediately start metro. I always tell people, separate the fish into a tank, keep the temperature a little up, and see it for a couple of days. Then you start metro or any kind of treatment. It's very important to have that hospital tank in a house. Next thing important in a hospital tank, very important thing is, whenever you do any treatment or any kind of thing, filtration is not needed, but you will definitely need very good aeration. Good aeration and oxygen levels actually come down when you do treatment. So you have to have very good aeration inside your tank. And of course a heater is very important. And of course with the heater, a thermometer. Both are very important, because the local heaters what we get here
or doesn't actually give you the right temperature. We have to always maintain the temperature at 30 degrees Celsius. So sometimes the local heaters you keep at 30, it goes up to 34, 35, 36. Eventually the fish also will go with it. So please don't use a heater without a thermometer. Always monitor temperature at 30 degrees. So these are the most important things in, before you start any treatment. Hospital tank with a air stone with very good aeration and a heater and a thermometer. So now we get to what is the treatment. Treatment basically, like I said, Metronidazole, it also is called Metrogel. Metro, it's also in different brands, they also call it Metro. Mostly commonly it is available in 400 mg. That is the general, the dosage what you get in a tablet, that is 400 mg. But you can check what is available in your place. So Metronidazole 400 mg is a common name or the common tablet what you get. Dosage very simple. We need 2 grams for 100 liters of water. 2 grams. So what is the tablet we are getting? We are getting a tablet for 400 mg. So 5 tablets of 400 mg makes it 2 grams. So we need 2 grams for 100 liters of water. So if you have a 50 liter tank, a hospital tank is 50 liters, please use the dosage accordingly. Reduce the dosage accordingly. For 100 liters we need 2 grams of Metronidazole. That is our basic calculation for treatment. We also get Metronidazole in IV. I have tried IV, the liquid, but it's not been very effective. So personally the tablets have always worked well. So like you see on screen, this is the tablet. That is better to use. It's my suggestion. You can also try IV based on your comfort level. Next, second thing in the tank what we need to add is rock salt. Non-iodized rock salt. Non-iodized rock salt, why? Because it helps in the fish's recovery process. So that is why rock salt is very, very important when you do any kind of treatment. Calculation for rock salt is 1 gram per liter. So like I said earlier, if your tank is 100 liters, use 100 grams of rock salt. Dissolve it well in a bowl of water and never add it on top of the fish. Add it in some corner, because directly when salt water falls or salt falls on your fish, sometimes the fish gets burns, and that's kind of very, very sad. So don't do that. So dissolve the rock salt really well in a bowl and then add it in one of the corners. We need to do this treatment for 5 days. Second day, on day 2, what we need to do is very simple. Do a 50% water change, add fresh water. Tablet is the same mg, that is the dosage is full dosage, because all antibiotics last only for 8 hours. The calculated dosage is full, but salt you need to add only 50%, because 50% of water is still remaining in your tank, so you don't need to add salt again. You need to add only 50%. Suppose it's a 100 liter tank, you have changed 50% water, that is 50 liters. You need to add only 50 grams of salt. You don't need to keep adding 100, 100, 100. Then that becomes a saltwater aquarium, but we are treating actually freshwater fishes, right? So keep that in mind. Never keep adding salt. Salt always remains in the tank. So add the salt only for the water what you have changed. Okay. After 5 days of treatment, we need to do on the 6th day 50% water change. No tablets needed. You can actually add salt. That's not a problem. It only helps in the recovery process. And on the 8th day, do another 50% water change. So overall, by 8 days, you have done the 100% water change. Please leave the fish inside the fish tank in this hospital tank for at least 10 days to 20 days, 10 to 15. I would say at least a month, because that helps the fish to recover. And it build up his appetite, and self-healing is very, very important for us all, even for fishes. So it's very, very important that they stay in that tank, so they're not disturbed by other fishes and all that, so they can slowly start taking food and then build their appetite and get back to normal, and then you add them back into the fish tank. A lot of people do this mistake of actually adding the fish back immediately after the treatment. So in the recovery process, they're in the tank where other fishes will keep bullying it, and it will take more time to recover, and maybe it might fall sick again. So keep it in the hospital tank for at least 15 days, I would say 1 week minimum. So if you can do it for a month, best. Do that, so the fish will start eating and all of that, and it can recover on its own and get back to full-fledged form, right? So one more important thing I would say, during some fishes actually still consume food when they have this hexameta or internal parasite attack. Those fishes you can still feed, but if the fish is not eating, there is no problem. But no excess feeding, because since a hospital tank doesn't have filtration, you need to have very little feeding. That's more than enough. If the fish is not taking food, don't worry. Start feeding from the 6th or 7th day. Start feeding food. try to give it very like some really good food, like which it really loves, like Australian black worms or something like that, so then the fish will kind of try to recover or try to start eating, and the fish starts eating on its own, healing will happen on its own, right? So this is the basics of how to do a metronidazole treatment. This basically is the total 5-day metro treatment. Observe your fishes and then you can decide if this has to be continued or no. Hope you guys like this video. If you did, give us a thumbs up, like and share, and do drop in your comments. Comments actually help us, motivates us to do more. And in case you have issues like this, do send us an email or follow us on Instagram and send us a DM. And if possible, we definitely try and help, because like I've told earlier also, I don't do this full time, it's an hobby, and whenever I can help, I always try and help my friends and followers. So until our next video, bye bye.